we have Dr. Ahmad Kushairi Khalid, consultant of the, okay, I'm not going to say it, but she's from the UiTM Private Specialist Center. Dr. Ahmad Kushairi, please tell us, what is your true profession? Which department are you handling?
So, firstly, thank you for inviting me to this show this morning. The proper way to, I know it's very difficult, but to pronounce it is otorhinolaryngology. It means ear, nose and throat in Latin. So yeah, so we deal with a lot of diseases of the head and neck region, basically, including the balancing disorder, which particularly affects the inner ear.
All right. I know German, but Latin is definitely, out of my league over here.
You're right.
So let's kick things off, because the fact that you are definitely a consultant, you're a specialist in this particular field. Maybe you can share with our audiences, what exactly does a balancing disorder mean? No.
All right. So a balancing disorder is actually when someone feels a bit unsteady or dizzy, or when they walk, they feel unstable or giddy. So sometimes when you change position, for example, going up from bed or going to stand from sitting down, you may feel a bit dizzy also. You can also feel that the room is spinning. So all this description may, means imbalance.
Right.
And of course, one that have this imbalance, there are a lot of characters that differentiates the cause of it. So in a nutshell, imbalance simply means unsteady, giddy, spinning movement, or you feel like you are swaying, like you are in a boat. All these are the complaints that the patient always make when they see us for these problems.
I guess the best way to, in layman terms, to describe it is when you go for one of those haunted houses, right? And you go inside those rooms that spins, and you have to walk straight into it.
Yes.
You lose your sense of balance.
Your analogy is just fantastic.
Yeah, that just reminds me of, like I said, I've had experience where middle of the night, suddenly I feel some form of dizziness. So I thought I had vertigo at one point. Because me and my...
It is vertigo.
Sorry.
Vitiligo is skin
problem. Sorry. Vertigo, yes.
Yeah,
my bad, guys.
That's why we have a professional in the house.
So that's what I felt. And thankfully, it only lasted the night, right?
Yeah.
So besides that, besides vertigo, what are some of the other imbalancing disorder that are out there that are common for audiences to, they can check out right now, or they can probably check their symptoms, whether or not they've experienced it.
Correct. When we deal with imbalance, especially when a patient come to me, it's very difficult to really ascertain the exact cause of the imbalance, because it could be anything. ENT or the diseases of the inner ear is just one of the cause. For example, a patient might have stroke. A patient might have, a cluster headache, which is not related to the inner ear, but they can also present with this imbalance of vertigo. A patient with low blood sugars, diabetics patient, they can also have symptoms of headache or unsteadiness. So when a patient presents to us, we really have to, examine, take the history correctly, and then do some imagings or blood tests to really help us to really diagnose what is the cause of the imbalance. So in a nutshell, we have to differentiate whether this imbalance is caused by central problem. Central means the brain, stroke, or systemic problems like diabetes, or low blood sugar, low blood pressure. That can also cause, or peripheral. Peripheral is specifically to the inner ear. So when we talk about inner ear, there could be a lot of other causes, such as infection of the inner ear, leakage of the fluid of inner ear to the middle ear, unstable of the crystal that, give us the sense of position in our body.
Right.
So all
we have a graph here. Do you want to show where roughly you're talking about?
So yeah, this is the picture of the inner ear, the cochlea, and we call this the labyrinthine system. So it is a bony structure which is fixed in the outside, where the inside it contains fluid with some crystals. So when we move, all these three semicircular canal, you can see the semicircular canal that orientates horizontal, vertical, oblique. All this is to give us the sense of position. So sometimes when we move too fast, some of the crystal will be dislodged and disturb the hair cell inside this canal. And that can give us a wrong sense of position for few seconds or minutes, you know. So yeah, that is the most
coming from a guy who took biology back in Form 5 during SPM, Salo Separuh Bulat. Yeah, no, we're not going to go there. but okay, because you mentioned plenty of times that it does affect the inner ear.
Correct.
The Salo Separuh Bulat, as I was just saying. But what could actually cause this? I mean, like, is it purely maybe you knock your head on the floor, for instance, or maybe somebody just bumped you? What could actually cause these kind of injury to your inner ear?
So there are various causes that can affect the inner ear. One for certain, we have this condition called benign paroxysmal positional vertigo. That means by moving our position too quick when we cannot compensate about the balance position, so it can give wrong signal. So this is one of the most common cause. And usually old age patients, or as we go older, our coping mechanism is lesser and it can cause these problems. Usually it typically lasted for seconds. And then we will regain back the steadiness. So this is due to position. Number two, we can have a fistula, or we call it communication or breakage in the bone of the semicircular canal.
Oh, wow.
That can cause leakage of fluid. Usually can be due to trauma.
Okay.
So this can also affect the balance sensation.
Right.
And then infections such as labyrinthitis or vestibular neuritis. These are infections that can ascend from middle ear or from the nose to the inner ear. And of course, particularly this patient will have other symptoms like fever, unwell, apart from the giddiness and vertigo. Other causes can be like Meniere's disease, which typically affects the hearing as well. So all these factors can cause balancing disturbance of the inner ear.
Personal question before Zoe actually asks you, misuse, or should I say the improper use of a cotton bud in your ear, could that also affect, or should I
that's a very common question. Okay, for cotton bud to directly injure the inner ear is far, because inner ear is located in the skull.
Okay.
So when we deal with cotton bud, is actually at the region of outer ear, and we have the eardrum to separate it. Unless someone really dig into the eardrum and poke the inner ear. I never had that kind of experience.
Well, thank you for that.
But when we clean our ear, because the nerve that innervates the balancing also have a branch into the outer ear. Sometimes it can cause a little bit of giddiness. I see this a lot when I clean the patient's ear in the clinic. For example, they can feel a bit of off balance at times, but it only lasted for a short while.
Right. So I think the main question here is, when should a patient come and see you?
Okay.
How often does the symptom have to arise for us to be saying to ourselves, hey, I actually need to see a doctor about this. Yeah, this feels like something serious. So when do you recommend for our patients out there who maybe have experienced, some form of dizziness, some form of balance, when should they come and see you?
Not a personal question, right?
Not a personal question for you.
No, I'm good.
But actually, this problem, because of its severity and the way it affects the patient, even if it occurs, one patient surely will come to you, because the feeling of unsteadiness with blurring of vision and the room spinning is very horrible for a patient to experience. So sometimes even once we'll take them to see us to make sure that there's no serious cause of vertigo or imbalance. So, but of course, repetitive episodes, and then if the vertigo doesn't go away, means that it lasted for days. Even you.
So what's the threshold then?
You cannot get up from bed. Even a few seconds, but repetitive episodes is indication to see. If vertigo affects a long period of time is indication to see. Or if it is related to other problems or symptoms like fever or ear discharge, for example, or if the person is elderly patient with other comorbidities such as diabetes, previous stroke, high blood pressure problems and stuff, that is also a warrant for us to assess them more. Things like brain tumors, I forgot to mention, can also cause this problem,
Wow.
We have to exclude all these things.
Okay.
Right. And we don't want to make people panic. Because when you say brain tumor, you don't, I feel like we don't normally associate it with any form of dizziness. But if you guys feel that way, then please mention it to your doctor, right?
Yes,
don't just keep it to yourself and think, alah, pening-pening lalat je. I think that's the most common saying with Malaysians, that we all just pening-pening lalat. It's fine, I'll heal.
Yeah, I mean, like, granted whatever that Zoe has just mentioned, a lot of people in Malaysia, we are self-doctors, unfortunately. We like to find our own self-remedies, our
Google,
ancestors, my atuk said this, my nenek said this, have this, that, and whatnot. What should be the tipping point? I mean, again, you can self-medicate all you want, but at the end of the day, if the matter is serious, only a doctor would actually know about this, right?
Yeah. I mean, being in Malaysia, there are a lot of alternative as compared to our conventional medical, ways of treating problems. But I mean, I cannot comment on the alternatives that is available because some patient might feel relief by it. Sometimes it works, but of course, if other alternative doesn't work, because it's not necessary medicine. For example, enough rest, low salt diet, plenty of exercise, hydration. All these are methods to improve the stability of the inner ear. It doesn't necessarily means you have to see a doctor. But if it doesn't go away with other measures, it happens frequently, and it really disturbs your lifestyle and confidence also, I think it's about time for you to get it checked seriously.
Right. So we had a quick video just now of you, I think, performing a checkup on one of your patients, right? Can you let us know, is there, I think this is the most important question here, is there a cure to this?
Okay.
Yes or no?
Depends on the cause. Some of it, yes, there is a permanent cure. Some of it, yes, it might recur again. But usually the things that can recur again is not too serious. For example, if there is a fistula, like I mentioned, a communication, or there's a breakage in the bone, once we seal it, the symptom will be gone. But if it is just problem of the crystal disturbing the fluid, of course, if you move fast again, or of course it can occur again, although you have correct the fluid, because we don't do anything to correct it. It's just by positioning back the crystal. But of course, the crystal can go back to cause imbalance. The maneuver that we do in the clinic regularly was to diagnose whether you have problem of the instability of this crystal. We call it Dick sulfide to diagnose. Then once you confirm to have that dizziness, once we do the maneuver, we can position it back with crystal repositioning maneuver, like Epley's maneuver, all these maneuvers, Simon maneuver, that can bring back the crystal back to its place. And of course, when that happens, the vertigo will be relief and gone.
So much that we have learned today in regards. I mean, this is not really a funny thing here. This is not really something that people should take lightly, because at the end of the day, should something is wrong with you, you need to get yourself checked up, regardless of whatever it is. That's all about the balancing disorder. We had Dr. Ahmad Kushairi Khalid, the consultant of
otorhinolaryngology.
Exactly.
I think we can pronounce this one time. I have it on my phone right here.
Please.
Let me just try it real quick. It's otorhinolaryngology.
Yes, you got it right.
Okay. There we go. Practice.
I'm going to save face and not accept the challenge. It's fine. Thank you so much, Doctor, for being on the show.
Appreciate it so much.
All right.